we're going to be talking about hamstring injuries. Toby, hamstring injuries are something spots people at all levels of ability for you're getting. Why is this? Well, you're right. Strings are the most significant injury in a number of team sports, including football and rugby, but any sports person could be affected. I think, looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional footballers, even though the average injury only takes about 3 weeks to heal. More worrying for the individual is that once they've had such an injury, chance of sustaining another one in the same season is as high as 20%, so it can become the thorn in the player's side that I think accounts for the reputation the injury has. So is this an injury that can affect any of us at any time? The hamstrings are a group of muscles in the thigh that allow us to bend our legs and knees effectively. Now, some ethnic groups are more predisposed to these injuries than others, and everyone's chance of tearing the muscle increases with age. But apart from that, they're generally the results of short bursts of movement, sprinting, or suddenly changing direction. And they happen more in certain sports just because these are just the sort of movements that players are making. They happen most often at the end of what we call the swing phase of running, just before the outstretched leg hits the ground and the muscles contract to bend the knee, but I'm sure there are ways to prevent these injuries. Well, looking after the muscles themselves obviously helps. Here, you can do various exercises that actually strengthen the hamstrings, so make them less prone to injury, and of course, warming up before exercise is crucial in avoiding all sorts of muscle strains, as far as people know that, but that isn't the whole story. One interesting finding is that a lot of people who develop hamstring injuries have coexisting back problems, and there would seem to be a correlation by loosening up the lower back. You also help the nerves that control the hamstring flexibility. There allows the muscles to function as they should, and there are size these people can do to help that, and is the risk of hamstring injury something that should be taken into account in training programs? Well, yes, intensive training of the sort you do for team sports, like football, can put quite a heavy workload on the gluteal muscles, which can lead to a tightening around the hips, creating knots known as trigger points. These in turn can cause referred pain in the hamstring, reducing flexibility and increasing the risk of straining, or tearing it. I mean, basic stretching exercises can help here. But also we know that muscles are more likely to strain if they're fatigued often. During a period of intensive training, you get cumulative fatigue. This can creep up on an athlete's on their muscular system over a number of weeks as the training intensifies. And if an athlete does pull a hamstring, how can the sports injury specialists help? They'll feel the pain. Maybe even feel a pop, and they won't be able to continue because the muscle will go into cramp and spasm. There are 3 degrees of severity and the treatment will vary. According to that, fortunately, as a sports injury specialist, you're often present when the injury occurs, or you can see it on video, so you don't have to rely on a verbal account of symptoms to assess the severity. Initially, you want to stop any swelling as soon as possible. Yes. Priority, you going to apply compression bandages, possibly ice. Although there's some debate about that these days. It does ease the discomfort and you'll certainly elevate the leg. Make sure the patient rests up. And how long will the athlete be out of action? Well, as I say, that's going to depend on the severity of the injury. They'll have to rest up for 72 hours. Whatever happens to avoid causing further the damage, and things like heat and massage can be just as damaging as movement itself. A grade 3 injury can take months to heal and can be career-threatening for top athletes. What's more, lack of use can lead to the development of scar tissue and muscle shrinkage. In other words, the muscles won't return to their former state even if the tear or strain itself heals. So, part of my job is to ensure that doesn't happen by getting the muscles working again in the right way as soon as possible. My name is Royce, and today, I'd like to talk about some unanticipated side effects of certain widely used medications. The side effects that I'm particularly interested in involves changes in a patient's behavior in particular. The onset of what's known as compulsive or pathological gambling in patients suffering from Parkinson's disease. Pathological gambling is essentially an addictive disorder in which the patient feels a need to engage in financial risk, taking in the expectation of gaining a reward. It is characterized by both recurrent and persistent behaviors and can lead to significant distress and the breakup of personal relationships. The condition is thought to affect around 1.4% of the general population, a figure which rises to 7% in Parkinson's patients. It was this finding that led to the realization that there was a link between the medication prescribed for that condition, notably dopamine agonists, and the onset of pathological gambling. So, how common is this side effect of Parkinson's medication? On the surface, it would seem that it remains the exception rather than the rule, only affecting around 1 in 7 users, and not all of those in a severe way, also because only a small proportion of patients treated with dopamine agonists develop the symptoms. It may reflect specific predisposing factors. The exact level of incidence is unknown. However, and this may be because many cases go unreported, patients themselves or family members don't admit to the condition out of shame or because their doctors or carers haven't been able to identify it. And this could explain why it doesn't show up more frequently in pharmacovigilance reporting systems. Let me give you an example of a typical case: a 74-year-old male. Let's call him Harry, who was diagnosed with Parkinson's disease and prescribed the dopamine agonist pramipexole about a month after commencing treatment. He began to feel an increasing need to place slot machines, until he was going to a gambling venue every day at first. How he was able to conceal his behavior. Some family members. Another common feature of the condition is wife did notice other symptoms. Harry was having difficulty sleeping and wasn't finishing his meals. But she put these down to his Parkinson's. It was when Harry began impulsively buying items that he neither needed or wanted that his wife became alarmed. It was at this point that the hole in his bank balance caused by the gambling came to light. Right? And the couple was able to seek help in other cases. Heightened sexual activity has been identified as an indicator. There are several underlying risk factors for developing pathological gambling at male gender: a previous or family history of gambling personality traits, such as high impulsivity and high novelty seeking. The risk increases when such people take agonists as treatment for Parkinson's disease. Originally, research suggested that the higher the dose and the longer the duration of the prescription, the greater the likelihood of compulsive symptoms occurring. More recently, however, research into the use of the medication for another condition, restless leg syndrome or RLS, has shown that symptoms can develop even at low doses. So what are the long-term effects of these adverse reactions? Pathological gambling seems to be reversible when the dose of the dopamine agonist is reduced. All the patient is transitioned to an alternative medication. Basically, dopamine agonists help Parkinson's patients by replacing the loss of dopamine in areas of the brain that control the ability to move, but the increased dopamine levels then affect other areas, such as the neural system, to pleasure and reward behaviors, and associated emotions, which then manifest themselves as impulsive and compulsive actions, but the effects are not long-lasting. Perry lost all interest in gambling within a month of stopping pramipexole therapy, but sadly for many patients, the problem isn't picked up before life-changing disruption is caused, as significant gambling debts develop and relationships become strained. So what can we do to improve the management of these side effects? There's no doubt that Parkinson's is a serious and degenerative disease. So the drugs may represent a reasonable trade-off in terms of risk-benefit analysis. It's hoped that by educating patients and carers about potential side effects, it'll make them more willing to report changes of behavior. Patients and their carers should monitor closely for the symptoms, so that as soon as any side effects do emerge, the drugs can be tapered or discontinued for other conditions such as RLS. However, it is open to debate whether the risks associated with compulsive behaviors outweigh The therapeutic advantages of administering the medication. What is needed is further research